The Prime Minister and premiers from across the country concluded a day-long meeting not too long ago. The first half of that meeting focused, of course, on the pandemic and the vaccine rollout. The second half, though, was an ask that came from the premiers to focus on a discussion around increasing what's known as the Canada Health Transfer, the amount of money that the federal government sends provinces for healthcare. Right now, the provinces spend about $188 billion on healthcare. This is pre-pandemic, just pre-pandemic. And the federal government covers $42 billion of that, about 22% of total costs. The premiers are calling for a boost of $28 billion to healthcare transfers, which would see the federal government cover about 35% of healthcare costs. For more on all of this, we have reached Dominic LeBlanc. He's the Minister of Intergovernmental Affairs, and he joins us from Ottawa. He was, of course, part of that meeting as well. Hi, Minister. Great to see you again.
Hi, Vashti. Thanks for having me in your program.
We listened to the Prime Minister's press conference today in which he said he does agree that the federal government needs to increase its share of healthcare funding, that the Canada Health Transfer by extension needs to increase. But right now, the focus is on the pandemic. When does your government feel the CHT should increase?
Vashti, so the discussion we think with the premiers today was very constructive. As you noted, the first half of the day was devoted to vaccines, to the ongoing collaborative effort with respect to COVID-19. General Fortin, Dr. Tam participated in that conversation as well. In the afternoon, when we talked about the ongoing Canada Health Transfer, we agreed right away with the premiers that we shared their objective of having a sustainable, first-class, accessible public healthcare system. Is it the best moment in the middle of the most difficult economic circumstance in decades, and in the middle of a pandemic we haven't seen in almost 100 years, to be looking at 10 years of exactly what's the right level in terms of the transfer to provinces? We reminded the provinces that we will, of course, continue to support them and Canadians in all of the expenses related to fighting COVID-19, including billions of dollars transferred this year to provinces for healthcare systems. We told the provinces, for example, that the Government of Canada was covering the entire cost of the vaccination program across the country, buying the vaccines, delivering them, the logistics efforts. And we were more than happy to sit down with them and discuss the ongoing ways the Government of Canada can increase its support to provinces for public health care.
I understand what you're saying, and I'm certainly not trying to take away from the federal contribution to the pandemic response and healthcare needs of provinces. But my question was more, if now isn't a good time, as you just described and the Prime Minister described, when is? Because the Prime Minister refused to say exactly what timeline your government was looking at.
So obviously, Vashti, for us to understand the public health reality 3 months, 6 months, a year from now, is not entirely clear. We've said that we'll continue to support those expenses that provinces have, and more importantly, the cost of supporting Canadians and Canadian businesses, as we have since the beginning of the pandemic. So the idea that COVID-19 represented this incremental, massive cost that the provinces cannot handle is not accurate, because we've assumed 8 out of $10 of every expenditure in terms of supporting public health care, public health measures, and Canadians. Also, Vashti, we began the conversation with the premiers by sharing the importance of having a common set of facts. So the numbers that are constantly used about the federal share, for example, refer only to the cash transfers that the Government of Canada gives to provinces and territories for healthcare. It doesn't contemplate the 13.5% of personal income tax and 1% of corporate tax that the Government of Canada, at the request of the provinces, transferred to them in 1977. So since then, they have had that space in terms of tax points to collect money for public health care, for example. So we thought, and Premier Legault and others agreed, that it was important to start very early in January in terms of understanding a common base of numbers, of information. What is, in fact, the federal share? We spend $5 billion a year supporting medical research and all kinds of other investments. So we're going to work quickly to get a common set of facts, and then work with them to figure out what is the right level of federal support that we acknowledge can increase.
Yeah, I take that those disagreements can exist, but will that meeting, will there be a meeting early in the new year? Because the premiers seem to think that the Prime Minister thought that would be premature. Are you saying there will be a meeting with the premiers and your government focus specifically on the CHT early in the new year?
So you're right. We've been meeting, Vashi, with premiers. This was the 23rd meeting in the last 7-8 months. We've been meeting every 2 weeks with premiers, and we'll continue to meet regularly, obviously, in the context of the pandemic. But we've agreed that finance department officials and finance ministers and others that can, in fact, help the provinces and the government of Canada agree on a shared set of facts, on a starting point to the conversation would be important. Those are the meetings that we're prepared to have early in January. We urge the premiers to work with us expeditiously. Also, Vashi, on things like long-term care, better care for seniors, sharing best practices. A number of premiers said to each other and to the Prime Minister, we need to share best practices that have evolved in the context of the pandemic. Some of the real challenges in the healthcare system were laid bare, some of the tragic outcomes in the last number of months. So we're ready right away to work with provinces on an increased support for long-term care, for looking after seniors. It's clearly a priority for Canadians. So this work will be ongoing and it'll be expeditious.
I understand that, and I understand it in the context of the pandemic, but these premiers have been asking, and premiers in general have been asking for a long time, so much so that your government, when it was campaigning, your party, when it was campaigning in 2015, talked about being committed to renegotiating, to re-engaging on the healthcare accords, on the health care transfer. All I'm asking for tonight is some sense of where your government's head is at when it comes to when you see what the Prime Minister said he was all for today, an increase in the CHT happening. Are you thinking, and I take your point that the pandemic is happening right now, but are you thinking that's something 5 years out, 3 years out, 2 years out, something that'll happen right after the pandemic? Can you give premiers a sense of that?
So, Vashi, you referred to commitments we made in 2015 to renegotiate the transfers. And we successfully signed agreements with all the provinces around a massive increase in transfers, for example, for home care and for mental health care. Those are priorities that we've had for a long time. And Vashi, we're prepared, as the Prime Minister said to the premiers, to start work right away on discussing the long-term support for healthcare in Canada. But we think Canadians want us to be very focused where they are in terms of what can governments do to protect them and their families from COVID-19 during the pandemic, and obviously put in place measures as important as vaccines and improved public health measures. We've sent 2 billion pieces of personal protective equipment to the provinces, which of course the government of Canada paid for. The same thing will be true with the vaccines. So we have supported provinces and will continue to support them, but are also prepared to have that longer conversation about what is the right level of increased federal support. But Vashi, we don't know what the Canadian economy is going to look like a year from now, 3 years from now, much less 10 years from now. Neither do the premiers. They're worried about their own structural deficits and fiscal circumstances. So are we. So let's start the conversation very quickly. And let's continue to work together in the meantime on what is a huge priority for Canadians.
Okay, not Premier, sorry. I've been interviewing a lot of them. Minister LeBlanc, thanks for your time tonight. Appreciate it.
Thank you, Vashi.
Intergovernmental Affairs Minister Dominic LeBlanc. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.